So as promised, we're going to start this section off by talking about teeth. We're going to have a few different combining forms here. We're going to start with the most basic one, dento, which is a combining form for teeth, as in dental, which means pertaining to teeth, or dentist, who is a specialist in working on teeth or correcting teeth. Teeth are actually very important not only to the GI tract, because it's how we begin the process of digesting food. They're also really significant in our cardio health. And we'll talk about that in just a moment. Our other combining form, odonto, which stands for tooth. So as in odontologia, which is tooth pain. So if you've ever had a toothache, or what we classically call a toothache, we see a couple depictions of that state here. Odontologia is what you were suffering from. It does require the attention of a dentist, and hopefully the potential arises to be able to save that tooth. Usually, of course, it's caused by something called a caries, which we might call a cavity, which means the enamel has been destroyed. And you kind of know the story. You've probably been around those before, or at least heard of them. Another aspect that we talk about with teeth is their straightness. And ortho is our combining form for straight. You've also heard me probably refer to orthopedics, which is talking about bones and muscles and keeping all that straight. But when we talk about the digestive system, the type of ortho we're referring to are orthodontics. This means pertaining to straightening teeth. And this is performed by an orthodontist, a dentist who specializes in straightening teeth. So for those of you who are interested in working in dentistry, and you're looking for and you want to work in healthcare, and you're looking for a job that's not going to put you on call, that you won't have to report down to the hospital at 4 in the morning, and you won't be working weekends, you'll be working Monday through Fridays, and you will always get a nice long lunch break and a very well-scheduled day. Orthodontics is a really great kind of practice to work in. If any of you have ever had braces, you probably know what an orthodontics office is like. My kids both went to Dr. Joyner's office, and those employees are the happiest people on the planet. They've got a great job. It's Monday through Friday, normal hours. They never get called to replace a brace down at the ER at 4 in the morning for an orthodontics emergency, because they just don't happen like that. So it's a great field to get into. You can earn really good money. You can make people happy and beautiful smiles. Yeah, you're never on call. Not a bad gig. So you've seen the word peri as a prefix. Now it's a combining form. So that's following what I've been talking about all along. That these word elements that we learn, although you learn them as a prefix, suffix, combining form, word root, they can switch around and take on different roles. Here, peri becomes a combining form. Perio, meaning around. Periodontal means pertaining to a rounded tooth. And a periodontist is a dentist specializing in periodontics. These are diseases of structures surrounding the teeth. So if you take that one step further, it's really saying they specialize in the health of gums. And the gum line is very, very important to keep teeth healthy. You see healthy gums on the right and diseased gums on the left. They have periodontal disease. That's what you're looking at in that picture. So you can see some erythema around some of those teeth. You can see that tissue is kind of deteriorating. The more inflamed that tissue gets, the more it's going to slough off cells, and the more it's going to be open to bacterial infection, and the more the gum line will be lost. So it's really important, if you want to prevent periodontal disease, to not only brush, but you have to use picks in between the teeth and up around the gum lines to clean food and especially sticky particles out of there. We talked about meat products, being sort of sticky, those molecules. Well, it's the same here in the mouth. Also, certain types of candy gets up under the gum line, can start breaking down gum tissue as well as enamel. Now, that's significant because, well, let me give you this one and then we'll talk about it. Gingiva. Here is when we talk about periodontal structures, we're talking about the gums. Gingiva is the combining form for gums. Gingival means pertaining to the gums. Gingivitis is inflammation of the gums. Gingivoplasty is a surgical repair of the gums. And gingivectomy is excision of the gums. The reason I chose to wait to give you the explanation I wanted to give until I got to this slide was because it kind of shows very well the build of a plaque in this drawing on the left along the gum line. This is why cleaning along the gum line is actually more important than brushing the teeth. I know we tend to focus, based on advertising a lot of times, to focus on the color of teeth. But really what the most important thing is what's the correlation and that very line between where the gum lines and the teeth match. Because if you don't get that area clean by using picks, flossing, and brushing, plaque will begin to build up. Same type of plaque that builds up in your coronary arteries or any place else in your body that's conducive to plaque, but mostly in the cardiovascular system. It's the same type of substance. It's hard. In the case with the teeth, though, it's brittle enough that a dental hygienist can go in and break that and clean it off. And so they use tools to break it down. If you've ever been to a dental hygienist, you've probably had that sensation of them scraping and digging around the gum line. Well, that's what they're doing. They're removing plaque. If they don't remove plaque, the gingiva, as you see here, starts to get very irritated and it starts to get inflamed. It starts sloughing off cells and the gum line starts to recede. And it will continue to recede for as long as it's being affected. As long as the plaque is allowed to stay there and grow, it will cause the gums to deteriorate. If you've ever brushed your teeth or flossed and seen blood when you spit out the toothpaste, you definitely have periodontal disease and you need to have that looked at. You could lose your gum line. You could actually compromise the integrity and health of your teeth. But more importantly, you could actually affect your cardio health because certain bacteria that will grow in these areas that get inflamed on the gum line in your mouth get into your bloodstream and can cause problems with the heart. So it's been established by the American Heart Association probably about 20 years ago. There is a direct correlation between periodontal disease and heart disease. They go hand in hand. Someone who has heart disease will have periodontal disease, and if you have periodontal disease, you're at high risk for heart disease. Bottom line, take care of the gums. The gums are just as much, if not more important to take care of than the teeth because it all has to work together. It's one unit. So there's my 2 cents on that. So you want a good heart health, make sure you have good gingiva health. Then we have this thing called the tongue. We have 2 combining forms, linguo and glosso. These are mix and match. So what I mean by that is, depending on the practice of medicine, you may hear either of these terms, but both are used on a regular basis. Some examples are lingual and glossal, pertaining to the tongue, and sublingual or hypoglossal, pertaining to under the tongue. The sublingual or hypoglossal is significant. When we talked about injections, we talked about the rate of absorption of a certain type of medication. So we inject certain routes to affect that absorption rate. That absorption rate in the oral cavity, under the tongue, in the sublingual or hypoglossal area, absorption rate is very fast there. There's a lot of vasculature. The saliva in your mouth will break things down immediately. So certain types of medication, like the stuff, nitroglycerin that I referred to when we talked about the symptom of angina with the vascular contracture that happens, and use the nitroglycerin to get in the bloodstream to dilate those blood vessels. Well, you put the tablet under the tongue because it will dissolve there, get in the bloodstream within a matter of seconds, and get to where it needs to go very, very quickly. So in medicine, and especially in administering certain types of medication, sublingual and hypoglossal are very important terms. Okay, so we have pharyngeo. I think we already covered this word in the respiratory chapter, but we're going to visit it again. Pharyngeo is a combining form for the pharynx, which means throat. You actually have 3 different types of pharynx in your body. We're going to talk about only the oropharynx, and we're not even going to call it the oropharynx. For right now, for your purposes, it's just the pharynx. So we see that the picture here, this is showing an oropharynx that's very inflamed. That thing in the middle that's hanging down would normally be a uvula. So there's some sort of inflammation going on in this oropharynx area. As you well know, if you look into the mirror at the back of your mouth, you can see a round opening in the back of your throat. And when you do that, you are looking at the oropharynx. Pharyngeal means pertaining to the pharynx. Pharyngeoplasty is a surgical repair of the pharynx. And pharyngitis is inflammation of the pharynx. And once again, in this picture, you're seeing very acute, very prominent pharyngitis. So for whatever reason, probably viral or bacterial infection, this oropharynx area is completely inflamed and looks like it's really sore, and I bet you it really is. Okay, so the pharynx talks about that area at the back of the mouth. I also mentioned before that we have the respiratory tract there and the gastrointestinal tract. Now, we talked about this thing called the epiglottis. You see it in this diagram here. They show the area where it's located and what that does. They haven't labeled it, unfortunately, but it's right up where you see larynx. So that structure in front of what they showed in the esophagus in the diagram, the structure in front is the esophagus, and behind it, is the trachea. and the structure behind it that goes all the way down is the esophagus. They're showing you that relationship. Right in that area where it says larynx is where you see the epiglottis, and that's what moves in order to keep food from going down the trachea and into the lungs. The esophagus is posterior to that. So when you palpate your throat, those rings you feel, that's the esophagus. Pardon me, that's the trachea. Behind it is the esophagus, and I apologize for mixing those up. The trachea is in front, the esophagus is in back. Esophageal means pertaining to the esophagus. Transesophageal is through the esophagus. Esophagitis is inflammation of the esophagus. Esophagoplasty is surgical repair of the esophagus. And esophagoscopy is a visual examination of the esophagus. So for various reasons, we're going to have to take a look at that. We often use, in radiology, we use something called fluoroscopy, where the patient will eat some type of food that has barium in it, and barium shows up on x-ray, and we will actually do a little x-ray movie of them swallowing. You can then see the peristaltic contractions. You can watch the mechanism of swallowing. You can see the tongue at work. It's a fascinating study. It's the first thing I ever got to see as an RT student at Dominican, and I was absolutely thrilled because I saw an epiglottis function for the first time ever. And it was super exciting for first day, first rotation of an RT student. It was pretty cool. So there's the esophagus. For those of you going into radiology, once you get into doing those upper GI studies and the barium swallows, you'll be able to witness this for yourself, and it's pretty cool. For the rest of you who may not ever do that, you can get on YouTube and find videos of what's called an upper GI or barium swallow. So you can look at those, and you can see the same thing I saw that day, most likely. Phagia, there's that suffix again. So swallowing, GI in the back. So hopefully you remember phagia. The GI associates to swallowing. Aphagia is the inability to swallow. Dysphagia is difficulty in swallowing. And polyphagia is excessive hunger. Now that is actually one of the three symptomatic profiles, and I'm referring to polyphagia here. Polyphagia is one of the three symptomatic profiles that we look at to consider whether a patient has diabetes or not. So excessive hunger, someone who's eating large amounts of food but still has hunger, the cells are starved for food. So we describe it as polyphagia. It might just be that you haven't eaten for a day or two and you're really hungry. But if this is an ongoing symptom of polyphagia and it's a daily thing and it goes on for a long time, it could be the indicator of the onset of diabetes. So it's something we pay attention to. Of course, there's other things involved with it, and we'll get into those in a later chapter. At the end of the esophagus, we find the stomach. Gastro is its combining form. Gastric means pertaining to the stomach. Gastritis is inflammation of the stomach. You can either say gastrodynia or gastralgia. I will tell you gastralgia is more commonly heard. Either one describes pain in the stomach. A gastrectomy is excision of the stomach. And gastroesophageal is pertaining to the stomach and the esophagus. So that's the relationship, obviously, between those two structures. One thing I did want to share with you about your stomach, and you may have noticed it in one of the earlier drawings, if you've ever seen an anatomical depiction of the inside of the stomach. It's filled with all kinds of folds called rugae, which help the stomach expand and contract. And you find that in other parts of the GI tract as well. But the other interesting thing I wanted to point out, which kind of relates to our next slide, is that you have acids that, as I said before, created by the liver. They're stored in the gallbladder and released into the stomach when you eat. So, and apologies to all vegetarians out there, but for those of you who are meat eaters and vegetarians, this is a good example. When you eat something like protein, which is from a mammal, which is very similar to yourself, the acid in your stomach can digest that protein, yet that acid does not burn a hole in the side of your stomach. Typically, if it does, it's called an ulcer. Why is that? Well, the answer is you have a mucosal lining in the stomach that it works against the acid, if you will. So acid, of course, is very acidic and can burn. And the other end of the scale from acid, the direct opposite, is alkaline. And alkaline resists acid, and it doesn't allow acid to do its thing. So the lining of your stomach in these rugae, it's lined with a mucosal lining that's very alkaline, and that resists the stomach acids from burning a hole in the side of the stomach. Now, sometimes they manage to do that, and we'll talk about it later. But when we talked about before that sensation of vomiting and having that burning sensation in the esophagus, that's the gastric acid affecting the lining of the esophagus, which does not have that alkaline barrier. So it's important to know. that's our 15 minutes. I'll be back with you in just a moment, and we'll continue on with more talk about the stomach. Thank you.